Obesity is a growing problem in Missouri and Illinois and across the United States as well. Now, we all know that diet, lack of exercise can play a big part, but scientists are unlocking some information that could affect millions of people, but not a lot of people know about it. Joining us now is Dr. Thomas Wright with the Laser Lipo and Vein Center and a patient, Sarah Brashear. Let's talk about the fact that a lot of times, Dr. Wright, diet and exercise just don't work for everybody, and so you have discovered they may indeed have a disease that needs to be treated.
That's right. There's a disease called lipedema. It's actually very common. It affects 9% of the female population, and it is a fat disorder, and it looks just like obesity, and it's often confused with obesity, but these fat cells do not respond to diet and exercise.
Mm-hmm. Now, Sarah, how long did it take you on your journey to discover that, okay, what I'm doing isn't working and I've got to see Dr. Wright?
About 10 years.
Wow.
I went from doctor to doctor, weight loss programs, weight trainers, trying to figure out what was going on with my body. I could lose maybe 5 or 10 pounds, but that was about it. Mm-hmm. And I kept growing in size.
Now, how did you hear about lipedema?
I started Googling big fat legs, is what I started to Google. And what I came up with was, lipedema, secondary lymphedema.
Have you heard of it up
I
until
had
then?
never heard of it.
Yeah.
But after I did a few more, Google searches, looking at some research, I thought, oh my gosh, this is what my great-grandmother had, this is what my mom has, this is what my sister has, this is what I have, and because it's all genetically related.
Dr. Wright, how did you treat Sarah?
Well, we treated her first with conservative to manage the fluid, and then with a lymph-sparing liposuction.
Mm-hmm. And what's it been like for you, Sarah, since then?
Life-changing. I would not be able to do what I do today. Mm-hmm. I own a bakery and catering company that I was looking at having to close because I couldn't be on my feet all day long. I couldn't walk a flight of stairs.
This is a before picture.
Yes, that is before.
And you brought some pictures here with you that we're going to try to show to our camera here. This is a before picture, you and your family on a vacation here.
Yes, that was in January of 2015.
January 2015. And when was this? This is the after picture.
That was November of 2016.
Okay.
I started seeing Dr. Wright in March of 2015. We did the conservative treatments all the way through February of 2016. So between February 2016 and August of 2016, he removed 26 liters of disease, fluid, and tissue in 3 different liposuction procedures.
Now, Dr. Wright, a lot of patients who struggle with weight may not know they have this disease.
Right. So they can lose weight in their upper unaffected areas, but in their legs or arms, this doesn't respond, and so they can become discouraged, and that's not right. So normal fat will respond to diet and exercise, but this lipedema fat does not.
How would you know if you have lipedema? Any symptoms, or you would just have to go get tested?
Well, so the first sign is the disproportionate accumulation of fat in the arms and legs, but then symptoms occur, such as tenderness and pain in the limbs, and then fluid accumulation is one of the more devastating parts of it.
How satisfying is it for you as a doctor to see and finally help somebody who's maybe struggling with their weight for decades?
Immensely satisfying. I mean, this is life-changing for Sarah and many patients like her. Untreated, this can lead to permanent disability and just awful existence. And Sarah and people like her are able to live normal, productive lives because of this.
Yes.
Yeah, and like you say, it's turned your life around.
Oh gosh.
And is it one treatment?
No, I've had 3 different procedures. I have to keep up with conservative treatment on a daily basis, though, to make sure that the fluid does not build up and things like that. But the liposuction stops the progression of the disease.
Okay. All right, Dr. Thomas Wright and his patient, Sarah Brashear, thank you so much for being with us. For more information, you can check out Laser, Lipo, and Vein Center, and I'm assured that they can find you on a website there. All right.
That's right.
Dr. Wright, Sarah, thanks so much for being with us. We
you.
appreciate it. All right. Best of luck to both of you. Thank you.